What's up everybody, Dr. Rossi, shrinksandsneakers.com. So in this video, I'm going to talk about sundowning. The other day, I got a question, kind of a curbside consult. A person's family member was experiencing this concept of sundowning, or was told by the doctor that they're having what's called quote-unquote sundowning, and they asked me exactly what that is or how to explain it. So I think it's a good concept to kind of go over here. It is something that we occasionally get consulted for on the medical floor, and it's something that we commonly see in patients with neurocognitive disorders or delirium. So we're going to crack right into the video. I'm going to explain and break down sundowning, exactly what you need to know. So let's start with the basics. What is sundowning? So sundowning is really not a specific diagnosis. It's more of a collection of symptoms that we see, in particular when a patient has a neurocognitive disorder, something like Alzheimer's dementia, or frontotemporal dementia, or Parkinson's disease dementia. It doesn't matter. Some type of neurocognitive disorder in combination, or has delirium. So, or it's some combination of the two, because we know delirium occurs in people with neurocognitive disorders quite often. So we have a collection of symptoms that's seen in patients with neurocognitive disorders or delirium, or a combination of both, depending on the circumstances. And it's interesting because it gets its name from the fact that the symptoms tend to begin, or seem to begin, when the sun is setting, when the sun is going down and starting to get dark out. So this leads us to the concept of, where does this mechanism come from? What's the potential mechanism causing this? Well, the theory is that it has something to do with your circadian rhythm. So circadian rhythm is our sleep-wake cycle, and as we get older, it gets disrupted in general. But in particular, patients who have neurocognitive disorders, it seems to get disrupted that much more. So the constellation of symptoms that makes up this concept of sundowning are the following. The person, as the sun is starting to set, as it's getting dark out, the person will have confusion. They might be disoriented. They might feel really tired. They might be agitated. And a lot of times they can also have ataxia. And in this confused, agitated state, they often try to get up out of bed and they try to walk around. So one of the things we worry about in the hospital all the time is somebody having a fall. And if you would have guessed that these patients are highly likely to fall, or highly prone to frequent falls, then you would be correct, because it's absolutely true. Now, where does this idea that the circadian rhythm, or what's the mechanism behind why this happens? So the theory is, as the sun starts to set, our dopamine levels start to decrease and our melatonin levels start to increase, right? And melatonin is a common sleep aid that's sold over the counter. It's used all the time. But what we see in these patients, as people get, this is in general, as people get older, but also specifically in patients with neurocognitive disorders, that the melatonin production decreases significantly. So if you have a significant decrease or deficiency in melatonin, you're not going to sleep regular, and your circadian rhythm is going to be disrupted. So that's where we think the mechanism comes into play. So using logic here, it might make sense that if you suspect somebody is having sundowning, if you suspect somebody is having some type of circadian rhythm disruption, leading to poor sleep and leading to some of these symptoms of sundowning that we discussed here, then you might want to offer them melatonin supplement. And melatonin is a very simple, very inexpensive, limited side effect medication that we can offer to somebody who's experiencing these symptoms. Now, there's other melatonin drugs as well. There's things called like Ramelton, which is a melatonin agonist. So this is a pharmaceutical drug that stimulates melatonin receptors. But if I was treating this, I would probably start with the melatonin, just regular old melatonin, relatively low doses, probably somewhere around 1.5 to 3 milligrams for these patients, and see how that goes first. And then if you feel like that's not working well, you could try the more powerful pharmaceutical drugs like Ramelton if necessary. So that's the basic concept of sundowning. If you guys like these videos, please subscribe to the channel. Continue to come back. We'll produce more content, and continue to drop comments and questions, because it helps me to know what you guys are actually interested in from psychiatry. If not, you just get whatever I'm interested in. So take care. I'll see you in the next